Tonight, we examine a pointed exchange during a confirmation hearing for the next U.S. Surgeon General, a role that blends public health leadership with symbolic medical authority. At the center of this discussion, whether an inactive medical license affects credibility, qualifications, or public trust. As lawmakers press for clarity, the broader question becomes not just about technical eligibility, but about what Americans expect from their top public health official.
I wanted to just ask you about the role of the Surgeon General, the different aspects of it. So one of it is about issuing public health advisories, is that correct?
Yes.
I wanted to just ask, are you currently able to write prescriptions for patients?
I have not been seeing patients over the last several years, and so I currently, with the status of my license that I voluntarily put on inactive status, which I'm sure what you're getting at, cannot prescribe a prescription right now. However, if I were to work with the Oregon Medical Board to reinstate that, it's very possible to do. And
is that something you're planning to do?
I'm not planning on prescribing prescriptions to Americans.
But are you planning to reactivate your license?
My path in medicine, I spent 4 years doing surgeries and seeing patients in clinics, and that one-to-one medicine, it's valuable, but my path took me down a different road to have a one-to-many approach to affect the root cause of why we're sick in America. And I've had a very successful.
So you're saying you're not going to pursue reactivating your medical license in taking this job. Is that correct?
I do not plan to reactivate because I'm not going to be seeing patients in this role.
So
it would not make sense to do that. In fact, for physicians, if I could just clarify, because this has been a point of severe misinformation from the media, for any doctor in a state where you are required to put your license on inactive if you're not seeing patients, I would imagine that many physicians in public health service who aren't seeing patients would have to put their license on inactive status because they are not seeing patients unless they choose to continue to do so while in office.
This exchange highlights a nuanced but important distinction in medical governance. In many states, physicians who are not actively treating patients may voluntarily place their licenses on inactive status, often for administrative or cost-related reasons. However, the Surgeon General's role is unique. While the position does not require direct patient care, it carries symbolic weight as the nation's doctor. The senator's questioning appears focused less on legality and more on optics and professional standards, particularly regarding leadership of the U.S. Public Health Service Commission Corps, where maintaining licensure is typically mandatory. The nominee, meanwhile, argues that eligibility has already been affirmed by Health and Human Services officials. So the core issue becomes one of perception versus procedure. Should public health leadership require active clinical standing, even if the job itself is advisory and strategic? And how might this debate shape public confidence in federal health guidance?
So another important role here, I just want to kind of clarify, because you're saying, you're not currently able to practice medicine. You're not currently able to write prescriptions because you're saying you're not going to be seeing patients in this job.
And I do have a medical
another
license
big role of the work that you're doing is to be a leader of the Commission Corps.
Yes.
Is that correct? So I guess I wanted to just dive into this because, with the Commission Corps, it's saying as a Commission Corps officer of the U.S. Public Health Services, keeping professional licensure and certification up to date is mandatory. So I guess I just wanted to get a sense of how you're squaring this here.
Well, I do have a medical license right now. It is voluntarily placed on inactive status because I'm not actively seeing patients at this time. The HHS and Admiral Brian Christine have testified in front of this committee that I am eligible to serve as the medical director of the HHS.
But how does that square with saying here it says keeping a professional licensure and certification up to date is mandatory? Is yours up to date?
I have an I have a medical license that is unexpired right now. Admiral Christine has testified that I'm eligible to serve in this role. I am the president's nominee for Surgeon General, and further questions about that will have to go to them.
So if you were to expand that, would you say that, like, with the others in the Commission Corps, do you think we should remove the mandatory licensure for them to be able to participate in the Corps?
That's not a question that I've considered. I don't think it's actually relevant to this particular hearing.
Well, it's relevant insofar as I'm just trying to think through, if you're in this job, how are you going to be proceeding, and what kind of advice you're going to be able to give to the American people and the credibility that they will have in understanding what your advice is. Also, in terms of, if you are a leader of the Commission Corps, I'm trying to get a sense, are you going to deprioritize having an active license in the same way that you believe that you can do the job of a Surgeon General without having an active license? Do you believe that that is the case for others in the Commission Corps, that they can do their job without having an active license?
Senator Kim, I'm a medical doctor. I graduated from Stanford University School of Medicine. I have a medical license. My professional history is a feature. It's not a bug. I have had a unique history that has merged entrepreneurship, public health advocacy, faculty, course direction at Stanford University, as well as being an editor of a medical journal and a biomedical researcher. And in these complex times for American healthcare, that type of multidisciplinary history is going to be extremely valuable for the American people.
I don't discount your accomplishments and your education, but what I'm trying to get a sense of here is your ability to be able to engage with our current medical professionals, to show respect to...
I practiced medicine. I owned my own medical practice, and I've seen thousands of patients, and I did over 4 years of surgical training, which is more than many of our past Surgeon Generals completed who did medical specialties. I have completed extremely thorough medical training, and I have the ability through these experiences to communicate excellent public health information, and I really look forward to working with the Commission Corps. This is an incredible group of people, 5,000 uniformed officers who are committing their lives to helping the American people. And personally, just to share a little bit of a vision,
I agree with that.
vision for that.
The signal that is being sent is one that I think we have to look at. And with that, I'll yield back.
This hearing underscores how qualifications in public service are often judged on two levels: technical compliance and public credibility. While the nominee maintains that an inactive license is consistent with a non-clinical leadership role, lawmakers are clearly weighing how that choice resonates with medical professionals and the public alike. In an era where trust in public health institutions has faced significant strain, even administrative details can take on outsized importance. Ultimately, the Senate will decide whether experience in surgery, research, and advocacy outweighs concerns about active licensure status. What do you think? Should the nation's Surgeon General maintain an active medical license, even if not treating patients? Share your perspective in the comments below. If you value balanced, fact-based breakdowns of major political moments, be sure to like this video, subscribe to the channel, and share it with others who want deeper context beyond the headlines.